Many thanks for staying with us here on News Desk. Now, 11 lives were lost on Thursday to attacks by some persons alleged to be mentally challenged. At Akrofuom in the central region, a mentally challenged man is said to have butchered to death 4 members of his family and 2 others. He allegedly sharpened 2 machetes on his return from the forest and carried out the murders. Let me hold on here. Go on to the phone lines now and speak to Richard Kojo, who has a lot more on this particular story. So, Kojo, tell us exactly how this happened.
Well, on Thursday, the suspect, Kwesi Ganu, and he lives in the same community. He's known to be an on and off person. When I say on and off person, he regains his sanity, and at a point he loses it. And so he's also on record to have been arrested by the police on some criminal charges. He was released recently, and he smoked weed. That is what the resident told me. And so in the afternoon, he sharpened 2 of his machetes and head to the family house. The mother, who was feeding one of their relatives, just completely cut off the head of the father, cut off the head of one of their nephews, and then cut off the head of another sister. And he proceeded to the landlord's house and also cut off the head of the landlord, and also butchered the son of the landlord. But he fortunately was rushed to the hospital and is currently recuperating at the Assin Akrofuom government hospital. The scene was a gory sight. I mean, the pictures are not quite good for people to even see, because you see one hand here, the other leg there, the breast of a human being lying, and the other, and the heads have completely been severed. Now, when that thing happened, he ran to one of the bushes and he's erected a hut. That is where he goes if he's smoking the weed. He goes there, and he's also known to have been terrorizing some of the residents. If people who are going to farm, he will chase you and will threaten to beat you up and all of those things. So when the mob realized that this was what has happened, they rushed on him and then they started beating him. The police came. When the police came to the scene and they rescued these people, the suspect, from the mob, when the suspect was sent to the Assin Akrofuom government hospital, he was pronounced dead. And so that is what has currently happened.
This man, who we are told is insane, who committed this crime, this heinous crime, has he been arrested at all?
Well, the man himself is dead, because I told you already that the mob killed him.
They killed him.
And the police attempted, because the police wanted to avert what the mob was going to do. And so they struggled with the mob. And in the ensuing process, the police, the vehicle belonging to police were even vandalized, but the police succeeded. When they sent the suspect to the hospital, he was already dead.
Okay. Many thanks for that update. Richard Kojo joining us with updates from the central region there, where that mentally deranged man went on a spree and actually butchered 4 members of his family and 2 others. That's his landlord and the landlord's son, actually. Quite sad there. But we are told of a similar incident also at Jamase in the Ashanti region. And in that particular instance, about 2 people or so were also butchered to death. Now, I mean, it's raised a lot of questions about security, particularly at this time, and the fact that quite a number of mentally challenged persons in the country are just left to parade our streets here with not much being done to get them out of the system. Indeed, if you do recall, early this year, there was a similar incident also of one man mentally challenged who apparently also butchered someone and actually bought kinky and used the meat of that person as meat. I don't know, really. But let's go on to the phone lines. Let's speak to Mr. Adolphe Okubekun. He's a clinical psychologist and lecturer at the Methodist University. He's joining us on phone now to help us understand a few things. I mean, how to handle some of these mentally challenged individuals in our society. Mr. Bekun, good morning and thanks for joining us.
Good morning and thanks for having me.
So a very worrying trend, it seems, over the past few weeks or so. Just yesterday, like I was saying, about 11 people lost their lives to such attacks. What can be done in the interim, really?
Well, what can be done is to fix our mental health system. We need to fix it. It is pretty clear that it is in shambles. Our mental health system is in shambles, and we are not paying much attention to it. Where would you keep them? Who are those trained to keep them? Where are the medications for them to take when they present as dangerous to themselves and to other citizens? Where are the medications? Where are the professionals to take care of them? Are we training them? Are we incentivizing them? So it is not just somebody going to beg. It just underlies how totally, completely overrun our mental health system is in this country.
So what's the biggest challenge with our system here, really? What's the challenge exactly?
It's financing. That is the biggest problem. Because professionals working in this field are the least motivated. There is a Mental Health Act that has been passed in 2012. What is needed to really implement the act is not available. This act envisages community mental health. So when people visit psychiatric hospitals and they are attended to and they are okay, they are followed up by community mental health nurses all over the place. What has happened to that? We are not averting our mind to one of the most important contributors to global health burden. That is mental health. Mental health is serious. If you don't have your sanity, you don't have anything. All right, it's unfortunate, and I commiserate with those who have gone through such terrible experiences. My condolences to the family, but it is a serious issue.
You've mentioned quite a number of things, suggesting that indeed, as a country, we haven't done so well in prioritizing mental health. But from where you sit, looking at the situation as it is and how it's played out over the past few days or weeks or so, does it look like this trend is likely to continue? I'm speaking of mentally deranged persons going around stabbing people and butchering people left and right. Is it likely to continue?
Well, I wouldn't want to forecast a very gloomy picture. But if our approach to mental health remains same, then I'm sorry. I'm sorry. Not only are they going to be dangerous to their case and king, they are going to even be dangerous to professionals who are attending to them, because medications to treat them, mental health professionals to attend to them, facilities to attend to them are all absent. So what are we building? A society, a great nation is not a great nation that builds skyscrapers. It is a nation that takes very good care of the most vulnerable in their society. And we seem not to be doing anything particularly about mental health. It is a shame. So yes, there are different levels of intervention that we need. The community itself. The community, how do they receive these people? Are they marginalized when they come in? Because indeed, if you marginalize them, if you stigmatize them, if you ridicule them, they become very angry and become dangerous. So the community itself, how are we treating these people? How are we receiving them? Do we understand mental health? Do we understand our roles and responsibilities, that we shouldn't reject them? Do we know what is happening to them when they are in crisis? Do we understand what is happening? It is a complete shame, and it's such an embarrassment. I don't want to even continue to talk about it.
Doc, many thanks for time on News Desk this morning. That was Dr. Adolf Ewuku Bekon. He's a clinical psychologist and a lecturer there, telling us a lot more about what really can be done and should be done about the situation, saying that government needs to do a lot more and focus on mental health. We need to reprioritize and get mental health on our top list of priorities. Indeed, you're watching News Desk here on the Joy News channel on Multi TV. We're taking a break. When we come back, Emmanuel Abwaji joins me with business. you.